right, good morning, everybody, and welcome. I am Kevin DeWald. I'm Executive Director for South Dakota HealthLink, and I'm pleased to welcome you to this first in a series of informational webinars. Today's call will be focused on how interoperability can benefit your organization. HealthLink is pleased to provide these short, concise webinars to inform and engage with our membership and help navigate the complex waters of the 21st century in healthcare. Please note, today's webinar is being recorded and will be made available for future reference or for those who may have missed this presentation. Today's agenda will include an overview of South Dakota HealthLink, updates on participants, data contributors to our expansive network, information on our interoperability services and the benefits to members, along with some exciting information about current funding opportunities to help new or existing HealthLink members. Next slide. I'm pleased today to have Kelly Lloyd with our Clinical Engagement Services team with me as our primary speaker. The rest of the HealthLink staff is noted at the bottom of the screen and are also attending today and look forward to engaging with you. Next slide. To start, I wanted to just give you a reminder of the history of HealthLink very briefly, and also some information about our statistics. As you can see, HealthLink has been around in the planning stages since 2007, and we have been fully operational as a health information exchange since 2010 and 11. We've spent much of the last 3 years working on data enhancements, so increasing the amounts and type of data that are contributed to our network, enhancing membership, along with strategic planning, looking at the future of health information exchange and how we can continue to meet the needs of our members. Next slide. Really, the benefit of the HealthLink network is really in our expanse. We span 6 states, so we are statewide in South Dakota. We have regional members in surrounding states of North Dakota, Minnesota, Iowa, Nebraska, and Wyoming. Our network consists of more than 68 hospitals and over 400 primary and other specialty care networks that are connected and contributing data. Additionally, we have begun to connect our network with other health information exchanges and federal partners through the eHealth Exchange. We're really excited that just a couple weeks ago, our connection with the Veterans Administration and Department of Defense is now live, allowing members to do a query for information on veterans or active duty military. Our Community Master Patient Index, which is how we match patients across our community, has 1.7 million unique individuals. So well more than twice the population of South Dakota, we have data in our network. And you can see all of the various type of recipients that we have at the bottom. For more information about our members, please visit our website, and there'll be information at the end of this call for the website to view all of our members. Although we won't have time for questions and answer session as part of this presentation, we do encourage you to submit any questions you have in the chat box at the bottom of the screen. We will capture those and either follow up with you directly, or they may be created into a frequently asked questions document to accompany this series of calls. With that, I'm going to now pass it over to Kelly Lloyd for the remainder of the presentation. Kelly?
Thank you, Kevin, and good morning, everyone, or afternoon, wherever you're located. Today, as Kevin mentioned, we are going to review the interoperability services that are available through South Dakota HealthLink, and then as well provide you with just an overview of what those services are and how interoperability can benefit your organization. I think over the past year, we can all agree that with the COVID-19 pandemic, it has certainly reinforced the importance of really understanding the complete clinical history of a patient in order to provide the best quality of care. And that's really what the goal of our interoperability services do. And so we're excited to share those with you on this webinar. So first, we want to just talk about the 5 core services that are offered through South Dakota HealthLink. So first, we do have our point of care exchange. The point of care exchange provides access to clinical information on patients, all within a single platform from across the entire community. We also have an event notification service that does create alerts for patients who have been admitted, discharged, or transferred from healthcare facilities across the community. Also, we have an electronic orders and results distribution service that allows providers to receive results automatically directly within their EHRs. We also offer a closed loop referrals management service that allows providers to send, receive, and track patient referrals across different healthcare settings. And then lastly, we are really excited to announce our new service that is offered in 2021 around population health analytics, where really we are now taking that information for you and really allowing you to gain better insights into your patient populations to help improve overall population health. So first, we did want to just talk about our point of care exchange and give you a little bit of an overview about what that is. And so through the point of care exchange, it really provides that single platform where healthcare providers can access patient clinical records from across the community, really on demand when and where they need it most, which is directly at the point of care. So oftentimes we hear from providers, they are required to log into multiple portals to obtain clinical information on their patients. Through the point of care exchange, we are pulling all of that information into one single platform where providers will have access to that information on demand. Through a single query within our point of care exchange, providers can now access clinical information on patients, including their laboratory results, imaging and radiology reports, transcribed documents. So if a discharge summary is being provided, you will have access to that. You can also run a medication query that will tell you a little bit about that patient's medication history, fill medications, and things of that nature. And then as well, we also have clinical care summary documents that providers can access through the point of care exchange. So if you are a member of a care team, I like to provide an example of, you have a patient, and I'm sure we've all experienced this, where they have been in an emergency room for a recent visit. That patient has had multiple diagnostic procedures and tests performed while they were in that emergency department. They are coming back to you for follow-up care. And oftentimes that patient really can't recall what tests were performed or what those results were. You as a provider or healthcare provider or a member of that patient's care team will now be able to access that information directly within the point of care exchange on demand when you need it. We did want to talk about our medication history query. So we had mentioned about the clinical information on a patient. Our medication query also allows providers the ability to not only see if a medication was prescribed for a patient, but did that medication actually get filled? So was there a problem where the patient was not able to fill that medication? You have the ability to not only now see was the medication actually filled for that or prescribed for that patient, but did that patient actually fill that medication as well through our query service? We did also want to mention that we have integration within HealthLink and the point of care exchange to the South Dakota Prescription Drug Monitoring Program. So providers do have access. If you are authorized to access the PDMP, you can also do that directly through the point of care exchange. Kevin did mention the exciting news about our partnership with the federal organization. So we do now have the Veterans Administration query live within the point of care exchange. And so if you are treating VA patients, you will now be able to access that information as well directly from within the point of care exchange. We did want to talk as well about our closed loop referrals management service. And so through this service, it allows providers who are actually referring patients out for specialty care or other services to be able to track those referrals from the point that that referral is initiated all the way through the end when that referral has been completed or closed. So it really gives you a better way to manage patient referrals and certainly can support with a better understanding of if that patient did present for that referral and certainly the closing of that referral and what were those consultation notes or what were the results of that referral for that patient. We did want to also share with you a little bit of information about our event notification service. So through our event notification service, it allows providers to be alerted when their patients have been seen in an ED or had a hospital admission or discharge. So it does provide those near real-time alerts for providers. There are several different ways that a provider can receive those notifications. So for example, we have a work list that a provider can receive notifications through. Providers can also receive a notification through an email and also a text message. So the nice thing about our event notification service is it's completely customizable by that user, and it allows you to select the way you want to receive those notifications that best fits your workflow. We have several different types of users who actually subscribe to our event notifications. So we did mention that primary care provider, and if you are a primary care provider who is really looking to support patients with that transitions of care from that acute care setting back to your primary care practice or that outpatient setting, that certainly is something that our event notifications can support. We also have a number of care management programs that subscribe to event notifications. So if you are part of a chronic disease management program and you want to know if you have high-risk individuals who are at risk for being admitted to an inpatient setting, and you want to be notified and be part of that planning process for that patient, certainly you have the ability as well as a member of that care team to receive those notifications. And also we did want to mention about quality improvement programs or initiatives. If you or your organization have quality initiatives programs in place around, and maybe it's around readmissions, or you want to understand and be able to understand more about high-risk individuals that are at risk for being readmitted into a facility, those are also types of notifications that you as a healthcare provider can subscribe to. And before we actually close with the event notifications, we did want to mention as well that there is a CMS requirement in 2020 that does now require hospitals, critical access hospitals, and psychiatric hospitals to provide those notifications, those electronic notifications for patients who have been admitted, discharged, or transferred within their organization. And we certainly can support that COP with our event notification service. It does meet all of the technical standards outlined by CMS. So if you are interested, we can certainly provide you additional information regarding that service as well. We did want to also talk about our electronic orders and results distribution service. This is another interoperability service offered through South Dakota HealthLink, where really if you are a hospital or a provider who would like to automate that workflow of getting results sent back and routed back to your EHR electronically, we can do that as well through through South Dakota HealthLink. So if you are a hospital right now and you are and your workflow does require faxing or maybe mailing results, we can certainly help with automating that, and our electronic results and orders distribution service can actually take those results and actually route those back into the ordering provider's EHR. All right, and then we also wanted to talk about our Population Health Analytics Service, which is our new service in 2021, that really can help support organizations and providers with really gaining those insights into their patient populations. So we are going to be able to aggregate that data, normalize that data, and be able to really show you, more information about the health of your overall population. So for example, if you are managing a diabetic population, you want to understand more about that population, if that patient has had, or that population has had A1Cs, if they went for preventative screenings, diabetic foot exams, you are now going to be able to use South Dakota HealthLink to run those types of population queries that will give you better insights into your population. It can certainly support you if you are trying to close the gap with quality measures for your patients. That is something that we can help as well with our new Population Health Analytics Service. So we are very excited to offer that service now new in 2021. So when we look at the overall benefits of interoperability to organizations, we certainly do understand that really the better picture that you can get about a patient's clinical history is certainly going to allow providers to have better informed decisions on diagnosis and treatment, and ultimately improving the quality of care. Certainly the ability to have that information on demand when it's needed the most, right at the point of care, can reduce those delays in care for waiting for any of that vital patient information, once again improving the continuity of care. Transitions of care is another area where interoperability can benefit organizations. So once again, if you are trying to support patients and really coordinate that transition of care from those hospital settings back to those ambulatory or primary settings, our interoperability services can support you with that and support those patients and getting them really back to the providers that are going to do that follow-up care for those patients. Also, once again, the full clinical history of a patient certainly does improve patient safety. We can support with obviously looking at a full history, a medication history for a patient, the full clinical history of a patient, and hopefully help reduce adverse events that may occur with patients that can't really recall that information, or maybe are a poor historian and can't really provide that information to providers. Additionally, when we look at interoperability benefits, it certainly does help as well with improving and reducing healthcare costs by eliminating the need for duplicate procedures and testing. So if a patient has had a recent test or a procedure performed, you are now going to have access to that information directly within the point of care exchange, and definitely that can help avoid any of those duplicate tests or procedures with not having the ability to gain that information right when providers need it the most. And then we look at the overall improvement to workflow efficiencies. Oftentimes, providers are required to call and get that information manually, or it does require patients to provide that information. You know, through South Dakota HealthLink, that is really going to eliminate that manual workflow, and it's going to allow you to actually log in and obtain that information right when you need it for patients, and really can improve your workflow efficiencies by, not requiring your staff to collect that information manually, make those phone calls, and receiving that information via fax or some of those manual methods. All right, so real quickly before we wrap up the webinar, if you are interested in signing up to become a member, we do have some funding opportunities and that are available if you are interested in making a connection to South Dakota HealthLink. Also, our membership fees to actually sign up and use interoperability services. There are no membership fees right now through September 30th of 2022. So if you are an eligible provider and can take advantage of that opportunity, we did want to mention that as well. If you are interested in making that connection, please feel free to reach out to us on our website and just let us know that you are interested. Submit your request. Our team will work with you on completing a participation agreement. After that participation agreement is signed, we will then schedule a follow-up meeting to really discuss your end user training and onboard, and really how that connection works with South Dakota HealthLink. We did also want to mention that we do have some upcoming webinar series in the future. So we do have a product showcase for our Notify or our event notification service. We do have a webinar scheduled in a couple weeks. So if you are interested, please feel free to log into the website and register to learn a little bit more about our Notify service. And then we do have future webinars coming as well with our products of the point of care exchange, as well as our population health analytics service that will give you a little bit of a deeper dive into what those services are and how you can subscribe and sign up for those. All right, I'd like to thank everyone for attending today's webinar. We do encourage that if you do have any questions after today's webinar, please reach out to us on our website. We will be happy to answer any of those questions that you have. We will also be posting an FAQ document with any questions that were received during the webinar. But once again, we'd like to thank you for attending and hope everyone has a great day. Thank you.